Thank you, ladies and gentlemen. Good evening. First, I would like to thank SINOVAC because you delivered the first vaccine for Indonesian people. So on behalf of the Indonesian government and Indonesian people, thanks a lot for your contributions on those vaccines. And second, I just want to give you a brief development on Indonesian Vaccination Program. I joined as a Ministry of Health around 10 months ago. I have zero medical background, as I graduated as a nuclear physicist and then 30 years in banking. So I don't really understand why the president chose me here, but I believe he would like to do it because he would like to see this vaccination is done as quickly as possible. So can I have my chart on the screen, please? What I would like to share with you is, next slide, quickly is, next slide. When the first time we designed our vaccination program by the end of 2020, the original design is for vaccinating 181.5 million Indonesians with the age over 18 years old. So we need around 363 million doses of vaccine. And I remember by the end of 2020, getting access to the vaccine were extremely difficult. So we are opening an early B2B discussions with several vaccine producers like Pfizer, AstraZeneca, Moderna, SINOVAC, Sinopharm, CanSino, and several others. But yes, to be honest, the quickest one was SINOVAC. SINOVAC dealt with Biopharma to secure the first millions of doses of vaccine. And those doses of vaccine arrived by the end of December. So we started our vaccination program on the 13th of January. In the middle, I believe around July or June or July, then the vaccine usage can be extended down to adult or young children with the age of 11 to 18. So that is where we can, then we add additional target from 181.5 million to become 208 million people. So we need additional around 50 million doses, and it comes to 416 million doses. We, as the other countries, we schedule the vaccination based on risk. So the healthcare providers is the first one to receive the vaccine, followed by elderlies and public officers, and then as what we are doing now is a general public and also young adult between 12 to 18 years old. And the pictures there were our president when he was vaccinated on the 13th of January 2021. Next slide. Now, we had a very slow start, not because the capacity of the infrastructure, but more because of the number of vaccine that we can access on the beginning of this year. But after August, then we can ramp up our vaccination activities because we have enough vaccine that we can secure starting on August. Now, Indonesia's position is number 5 for number of people who receive at least the first dose. And we are also number 5 in terms of number of vaccine doses administered after China, India, United States, and Brazil. Next slide. So when we what this chart I would like to share with you is again the speed. So our first 50 million doses we reached around 26 weeks. So we started on the 13th of January. We reached our 15 million doses on the 8th of July. And then the next 50 million doses we reached in 7 weeks. So 8th of July until 31st of August. And then for the next 50 million is another 5.5 weeks. And then the last 50 million, we can do it exactly, 1 month from 6th October until 4 November. Again, it depends really on the availability of the vaccine. As of yesterday, we have vaccinated 219 million doses, 232 million Indonesian for first dose, and 86 million Indonesian 2 doses. So we have vaccinated 63% of our target population, because Indonesia, I believe some of the virus has got a breakthrough infection and enter my internet network. So we have to, maybe it is a new epsilon variant that we haven't found recently. But and anyway, so Kiki, can you move to the next slide, Kiki? Next slide. So as you can see, this is the progress. Now I can share with you the dynamics beyond this data, which is what interesting. When we start early, I remember we only do 100,000 jabs per day. And many people, including the famous magazine, The Economist, mentioned that if Indonesia do this, then Indonesia will finish the vaccination in 10 years. I didn't get the chance because at that time we are extremely busy to explain to The Economist, but I just got the time just this morning. And I talked to them, the reason why I only do, 100,000 jabs per day, because I only have 3 million doses available from SINOVAC. So if you remember at the beginning, SINOVAC sent us the ready-to-use vaccine. It's not a bulk vaccine. And after that, you send the bulk vaccine, but bulk vaccine, it takes time, to produce, to become ready-to-use vaccine. So I only received the first 3 million. And I said, 3 million, if I divide by 30 days, so I can only do 100,000 a day. I cannot do more. If I do like 1 million jabs per day, and suddenly after 3 days, all Indonesians will scream to me and asking for vaccine. So we intentionally pace the speed of the vaccination program. After July, when we receive enough vaccine, then we can do 1 million jabs per day, because we have between 30 to 50 million doses of vaccine every month. And then when we have more vaccine, we move it higher. Our record is 2.4 million jabs per day. And for the last 5 weeks, 6 weeks, we actually always reach close to 2 million jabs per day, which is, if I compare with other countries, I just had a meeting with my colleague G20 in Rome. I think we are the highest, even compared with Western country like United Kingdom or even United States. Recently, we did faster than them, but of course we are behind China and India. You are at a different league. You are at a different league. But what I can share with you, on March, I realized that it will be difficult to get the tractions. Why? Because our system, logistics system, we send the vaccine to the provinces, and then the provinces will distribute the vaccine to the cities. That is the system used by the previous government before the crisis in 1998, where everything is centralized. But with the reform of Indonesian political system, after Suharto went on, after our famous president, then we decentralized the government. So the issue is that the local government is being elected. So they're not really 100% the employees of the central regime, because they're elected by the people. Then it created issues, because they are also political appointees. And then when we distribute to them, it's not 100% equally distributed to all the cities that have a different political affiliations. So we noticed that, and I think it happens also with other countries that have a similar political system. Then we start sending directly to the cities and regencies. I believe it started on March. So there is a certain surge on March about that. But then after that, you can see a drop. It is because then we realize that the regencies and cities across Indonesia, they don't have the similar capacities in do vaccination program. So what we did, the end of April, we involved the private sector because the private sector want to get vaccinated as quickly as possible. So after 30 years as a banker, I have access to all of them. So I called all these rich families and big corporations and I said, why don't you help me vaccinate the people? We will provide you the vaccine and you create the vaccination centers in the cities that you operate in. So when you saw there is an increase in May and early June, that is because of that initiative. But then we realized that when the vaccine, the ready-to-use vaccine will come in a large amount, we measured that the capacity to do the vaccination will not be enough using this channel. Then by early of June, I talked to the president and asking the president to assign the army and police to help us. Because Indonesian army and Indonesian police are controlled by the central government. They have offices everywhere in our 13,000 islands, 514 cities, and they are very, very disciplined. And they have doctors and nurses also with them. So when you start seeing the significant increase in July, it's because of the army and police are helping us. And then when on August, we have enough doses of vaccine, as you can see, then we have the momentum already. So we have the momentum already. And now we reach around 2 million doses. You might notice that in the last 2.5 weeks or 3 weeks by now, it's declining. It's very funny actually, and it is related with SINOVAC also. And when the first time we start with SINOVAC, because it was the only vaccine that we have, a lot of people are challenging in us, including our own people, Indonesia. Why did you choose SINOVAC? Because the efficacy is low. Why don't you take Pfizer or Moderna or AstraZeneca? And I said the only reason is because SINOVAC provide the vaccine the fastest to Indonesia. And based on the discussion with all the epidemiologists, the fastest you can vaccinate your people, the better you are. So we just want to do it quickly. And that creates an excellent branding for SINOVAC in Indonesian people. Especially SINOVAC effect after vaccination is considered very, very mild. Very, very mild. So when we start having another type of vaccine, AstraZeneca, Pfizer, Moderna, where the after vaccination impact is actually, more severe than SINOVAC, so people get afraid. Now what happened in the last 3 weeks is SINOVAC has come to the peak, the order, because now the new batch of AstraZeneca, Pfizer, and Novavax start coming into Indonesia. So SINOVAC has been used, I think close to 100 million or more than 100 million doses. And then we start vaccinating using Pfizer and AstraZeneca. And to my surprise, this is again the emotion of the people. They're still looking for SINOVAC because they believe that, it is more mild. You don't get hang out after vaccination. So then I had to re-educate the people again that, hey, vaccination, you don't care about the brand. As long as you get vaccinated, that is the best way to go. So now we are still struggling a little bit because in the last 3 weeks, when the volume of SINOVAC vaccination is being replaced by AstraZeneca and Pfizer, the public perception in Indonesia, which is good for SINOVAC, is still very SINOVAC minded, very SINOVAC minded. Next slide. So this is the schedule of the vaccine delivery. Actually, the original schedule, we can get 460 million doses. So enough for vaccinating 208 million. But starting on October, the end of October, we realized because we have a lot of vaccine coming in on September, and especially vaccine that come from COVAX, Gavi, then they have a very short expiry date. When expiry date is very short, sometimes it's very difficult to distribute to the remote area, because from January to August, we already vaccinating the large cities. The easy part, the large city, large population, we are vaccinating them. So starting on September, we start to go to small cities, which is logistic is more difficult, transportation is more difficult. And then during the time, we have a lot of vaccine coming in, and including vaccine on September coming a lot from COVAX, Gavi. This is a free vaccine. Actually, they want to give us 108 million this year, but when I see the capacity of our systems and also that the short expiry date, let's delay a little bit, because now we still have around 50 million vaccine stock all over across the cities and provinces in Indonesia. So we postpone about 50 million to 2022 first quarter, which is a month period, usually 50 million doses. And we will end up around 418 million doses. And as you can see, we have many brand vaccination. We have SINOVAC. I think SINOVAC is the most, and then followed by we have AstraZeneca, we have Pfizer, and we have bilateral grant from several cities, 22 million already. It is a free vaccine from our neighbors, and mostly Pfizer or AstraZeneca with some Moderna. And also we will receive, we are receiving 60 million doses from COVAX Gavi out of 108 million committed doses from COVAX Gavi. But COVAX gave us quite a lot because they see that we can do the vaccination quickly. We can do the vaccination quickly. Next slide. So our target is Indonesia is very spread, the country. Infrastructure is also different among cities. And our target is for every provinces, 34 provinces in Indonesia, our target is to achieve 60% of the target population's first dose and 70% of the target populations by December. So 60% first dose by November, 70% first dose by December. Usually when we reach the first dose, it's between 4 to 6 weeks that it will complete the second dose. It will complete the second dose. And we have seen that several countries are lagging, especially Papua, you know, our eastern part island, and then Aceh. Aceh is also the western side of Indonesia. So our job now is send our resources, the armies, the police to accelerate the vaccinations in Papua and Aceh. So that is where the number of vaccinations is the lowest. Next slide. I think the key message that I would like to share with you is it is something, the vaccination program at this scale is unprecedented for Indonesia. And I think I also believe for many countries. Usually we only do like 30 million to 50 million vaccinations a year. Now we have to do close to 400 million vaccinations per year. It is like 8 times the normal volume that we do. And our geography also make it much more difficult, the situations, because we have 13,000 island and it's separated by sea. So it's make it more complicated. So since the beginning, I believe that it is not something that we can do individually. This is a program that we have to do it together. It is something that the government cannot, exclusively push this program, but we need to inclusively involve private sectors, the regional government, the police and army, to make sure that we can execute this vaccination program as quickly as possible. And I'm happy to see the result is because now every Indonesian believe it is important and they want to do the vaccination program either at the small scale, your community level, or your alumni of one university or your alumni high school, and they do it on their own expenses. So the final things that I would like to say is we can do this because now the Indonesians see this vaccination not as the government program, but as a national movement. In program, somebody owned the program. In movement, everybody owned that program. So everybody believed that we need to be vaccinated and we need to work together to get our communities and families vaccinated. Indonesia is Indonesian culture is very social. The social capital is extremely large. As long as we can consolidate the social capital and unleash the social capital or our people, actually that can really be so powerful and help the task of the government. So that is a short story of the Indonesian vaccination program. Again, I want to thank SINOVAC because you are the fastest and you are the first one to deliver the vaccine to Indonesia. So on the behalf of the Indonesian government and Indonesian people, please accept my gratitude. What you have done is not only saving Indonesian lives, but it's also a tribute to humanity. Thank you.